Let's discuss the top 5 common side effects for CPAP users. Number 1, dryness. Sometimes we can address this by increasing the humidification because you don't have enough. Other times, if you're continuing to have dryness because you're using perhaps a nasal mask and maybe you're opening your mouth at night, we can correct that with a chin strap or maybe try moving the patient to a full face. Number 2, nasal congestion. This can sometimes also be a common side effect due to not enough humidification, or perhaps the patient battles seasonal allergies and they need to take an over-the-counter antihistamine, or also you can use nasal sprays and other saline rinses that your physician recommends. Number 3, mask discomfort. This is a very important one because we want to address mask discomfort at the beginning of your CPAP use. There's so many different masks and things that we can try to really get the patient comfortable. Starting off with adjusting the mask. Is the patient truly wearing their mask correctly? Are there other things that are causing irritants to the skin? Or maybe they have it too tight or too loose, causing discomfort? There's a lot of things that we can look into, but our Apnea Sleep Care team has sleep coaches to help guide you throughout the way to ensure that you do have a proper fit. If after all those things are resolved and you still are having discomfort with CPAP therapy, we might recommend a couple of other items that you can purchase online at apneadirect.com to help you make it more comfortable for you during your sleep therapy, such as rimsies. They're a cloth lining that you can add to the circumference of the mask and place next to your skin and around the mask to help with a seal. Number 4, claustrophobia. It can be difficult to get used to CPAP therapy. So at the beginning, we do recommend that if you are claustrophobic and it takes you a while to acclimate to CPAP therapy, perhaps when you're sitting and watching TV, apply the mask and start getting used to having the pressure on your face and the mask. If you read a book in bed, try applying the mask and try to get acclimated as much as you can to really overcome that fear of the claustrophobia. A lot of times patients will find that the more that they have it on when they're awake and they get acclimated to it, the better they are throughout the night. Number 5, skin irritation. Sometimes patients do become irritated around the area that the mask might be sitting. Again, addressed earlier a little bit, there are a couple of items that we can add to the CPAP therapy to help. Again, when we talked about rimsies, that is an item that can be added for skin irritation, and also, again, addressing if the patient has the mask too tight. A lot of times patients will tighten their mask way too tight, and it causes marks on their face just from having the mask not appropriately fit in. Our Apnea Sleep Care team is here to help you adjust all of these common side effects and help guide you throughout the way.